Hi everyone, I'm Dr. Sita, Clinical Director and Fertility Specialist at Boon IVF. So today let's discuss about ovulation predictors. So how can we know whether you're ovulating or not? So your body undergoes a lot of changes during the time of ovulation. By monitoring these changes, we can understand whether you have ovulated or not, or when are you going to ovulate. First thing is, are your cycles regular? If you're having regular cycles, then it is very easy to predict your ovulation date. If you're having a 28-day cycle, for example, then you roughly ovulate 14 days before, that is on the 14th day of your period. If you're having a 30-day cycle, then you're ovulating on your 16th day of your cycle. Likewise, depending on your cycle length, you subtract 14 days and that will be the day of ovulation. So first thing is, are your periods regular, and depending on your period length, you can predict your ovulation. Next is, there can be a slight pain in the abdomen at the time of ovulation. Slight cramping like pain in your abdomen at the time of ovulation, and some people can observe slight spotting at the time of ovulation. So this is completely normal, nothing to worry, but these are also predictors of ovulation. Third is a change in your cervical mucus. So the cervical mucus becomes more thin and more liquidy kind of a thing, like how an egg white is there. So it becomes more thin, and your cervical mucus actually increases at the time of ovulation. Fourth is your temperature. So your basal body temperature increases post ovulation. This is because of the effect of the hormone of progesterone, but this is retrospective finding. So once your temperature increases, that means you have ovulated. As this is a retrospective finding, it is very difficult to tell when to have intercourse when you're monitoring your basal body temperature. So the most fertile days when you're monitoring your basal body temperature is 2 days before your temperature rise. So this is a retrospective finding, it becomes very difficult to predict the ovulation, but this can help in telling you whether you have ovulated or not. Next is LH kits. So you can know whether you're ovulating or not by testing your LH levels in the urine. There are commercially available kits in the market which help in predicting whether you're ovulating or not. So in that kit, if you get 2 lines, that means you're ovulating in the next 24 to 36 hours and you can have intercourse in the next 2 to 3 days. That will be your fertile period. The last and the best method and most confirmatory method is doing a follicular monitoring. So follicular monitoring is generally done through a transvaginal ultrasound, and we keep monitoring your follicle, and when the follicle ovulates, we can see the follicle crumple and we can see some fluid in the abdomen, and we can see that the follicle size has also decreased. This is the most confirmatory test for ovulation and the most accurate one to know whether you have ovulated or not. So by monitoring your temperature, second is your cervical mucus changes, third is having some pain or some slight spotting during the time of ovulation, fourth is monitoring your period cycle, roughly 14 days before your expected period is your day of ovulation. Fifth is by monitoring your urinary LH levels through the LH kits which are available in the market. And sixth and the best is getting a follicular monitoring done. I hope this video was useful to you. You can reach out to us for any queries. We will be very happy to help you.